Welcome to the deep dive. Today we're getting into something a lot of dog owners deal with, or at least worry about: aggression towards unfamiliar people and, well, other dogs too.
Yeah, it's a big topic.
It is. And we've got this great source material, our pasted text, that really breaks down this complex behavior.
It does offer a lot of detail.
So our mission today is basically to pull out the really crucial stuff from this source, to help understand why a dog might act this way towards outsiders and what that looks like without getting totally bogged down in jargon.
Sounds like a plan. It's definitely layered, and right away the source makes it clear, doesn't it? There's no single aggression switch.
Right. Not a simple explanation at all. The research mentions several motivations. Fear, obviously, that makes sense. A scared dog might lash out.
Defensively.
Then there's territoriality, protecting their turf. Conflict, which sounds like, I don't know, feeling cornered maybe.
Yeah.
And even possessiveness.
Exactly. And it's interesting how the source notes that even regular visitors, like maybe the mail carrier, can still fall into that unfamiliar category for the dog.
Yeah, that surprised me a bit. It's about who's in their inner circle, I guess.
Precisely. And while it's worrying for owners, the source does point out that, some level of this guarding or caution can be kind of normal dog behavior, though fear can definitely crank up the intensity.
Okay, so how common are we talking? The research had this number that, wow, kind of jumped out. Stranger-directed aggression is like 32.5% of behavioral referral cases.
That's huge.
It really is. That's almost a third.
It shows just how many people are facing this. You probably know someone, right, who has a dog that barks at strangers or gets tense around new dogs.
Oh, for sure. It's definitely out there. And it doesn't always just pop up overnight, does it? The research talks about timing, like key periods when it might start showing up more.
Like when that early socialization window starts to close around, say, 12 to 16 weeks old.
Right. And then again, potentially when they hit what the source calls social maturity, like doggy adolescence.
Kinda, yeah. Around 18 months to maybe 3 years old.
Yeah.
That's another period where you might see these behaviors emerge or intensify.
That's useful to know. But the research also mentioned something concerning about signs showing up really early, like before 12 weeks.
Yes, that's a flag. If you see strong fear or aggression that young, the source suggests it might point towards more significant genetic factors and maybe a tougher road ahead for management.
Good to be aware of. And then there were some like general trends mentioned about male dogs maybe being more prone to it and certain breeds.
Yeah, the source did mention higher rates in males for aggression towards unfamiliar people and dogs. And for dog aggression, breeds originally developed for fighting, and some terriers were noted as having higher predispositions.
Oh.
But, and this is crucial, these are just tendencies, general patterns. An individual dog's life experiences, their training, their environment, that all plays a massive role. It's not deterministic.
Got it. So, okay, we have some ideas about the why and when, but what does it actually look like? What are the signals? Barking, yeah, but it's more than that, isn't it?
Oh, definitely. The source lists the whole spectrum. You've got the obvious, like you said, barking, growling, maybe even biting, but also things like lifting the lip, snarling, snapping the air, lunging.
Okay.
But here's a really fascinating bit the source highlights.
Oh.
These aggressive signals, they can show up alongside body language that looks totally fearful or totally confident.
Yes, that was a key takeaway for me. You might see a dog lunging and barking, but their tail is tucked, ears are back, classic fear signs. But then another dog might be doing the same thing, standing stiff, tail high, looking really bold. It's not always straightforward confidence driving it.
Exactly. It shows aggression isn't just one emotional state. A really scared dog might still choose a fence if they feel like they can't get away, which ties into territorial aggression.
Right, the stuff that happens in their familiar spots, home, yard, car.
Yeah, and that territorial response, according to the source, can stem from fear or confidence or that murky conflict state again.
And pitch and fear is more likely if the dog feels trapped.
That's what the research suggests, yeah. If escape seems impossible, fight might look like the only option. And whether they're on-leash or off-leash can also change the dynamic, maybe affecting how much control they feel they have.
So digging into causes and risks, the source kind of repeat that this can be normal canine behavior, which is interesting framing. But then it really hammers home the impact of the dog's past.
Hugely important. Early life experiences are critical. Lack of good socialization during that sensitive puppy period, big impact.
Okay.
Also, things like painful experiences, maybe rough handling, or owners using punishment in ways that backfire and increase fear.
Right. Inappropriate punishment is specifically called out.
Absolutely. And just, previous bad run-ins with strangers or other dogs. Those negative associations stick.
Makes total sense. Like, if a dog got spooked by someone wearing a big hat, suddenly all hats are suspect. And the source brings up medical issues too, especially pain.
Yeah, that's easily missed. Chronic pain can make any dog grumpy, lower their threshold for annoyance or fear. Could look like aggression out of nowhere, but it's rooted in physical discomfort, something for owners to consider maybe. Any subtle signs of pain?
Definitely worth thinking about. Now, figuring out the exact diagnosis. The research lists several possibilities. Fear, aggression, territorial, possessive. It sounds complicated. For owners, what's the big don't here?
Yeah, crucial point. The source mentions standard vet tests are usually normal unless there's a medical cause, maybe an MRI in rare cases. But the key message for you, the owner, is please, please don't try to diagnose this yourself.
Right. No Dr. Google for dog aggression.
Exactly. It's complex. You need a qualified professional, a veterinary behaviorist, or a certified trainer with real expertise in aggression. Guessing can lead you down the wrong path, maybe even make things worse.
Leave it to the pros.
Yeah.
Okay. So, once a professional has assessed things, what are the core ideas for tackling the behavior?
The research frames it really well. The goal is usually management and control, not necessarily a cure. That's vital for setting realistic expectations.
Okay, managing expectations is key.
And success really depends on the owner getting it. Understanding dog body language, the risks, the safety measures needed, pinpointing the triggers, and then this is essential using reward-based methods to change the behavior.
Safety first. Right. The source really drills down on that. Preventing incidents isn't just about protecting others.
No, it's also about preventing the dog from practicing the aggression. Every time they rehearse it, unfortunately, that behavior can get stronger, more ingrained.
Makes sense.
What?
So avoiding triggers is step one.
Absolutely. The research strongly recommends a period of just avoiding known triggers before starting modification training. Let everyone calm down, reduce the stress, and it mentions the legal side too, potential bite liability.
Yeah, important reminder. And practical safety steps.
Lots of them. Physically separating the dog crates, gates, different rooms, avoiding chaotic places like dog parks if that's a trigger, always having direct physical control like a leash when triggers might be around. And for territorial dogs, managing their environment so they can't, say, sit at the window and bark at everyone passing by, blocking visual access, maybe using white noise for sounds.
Good tips. The research mentions tools too, like head halters or basket muzzles.
Yes, as management aids. Used properly, introduced positively, they can add a significant layer of safety during walks or training. And a huge point the research stresses: no punishment or dominance-based training.
Big warning sign there.
Huge. It often increases fear and anxiety, making aggression worse and less predictable. And sometimes the research acknowledges if safety just can't be reliably maintained, really tough decisions like rehoming or, sadly, euthanasia have to be considered.
Hard truths, but safety has to be paramount. Okay, shifting gears to the positive side. The source talks about structured interactions, this learn-to-earn idea. What's that about?
It's a great concept. Actually quite simple. Basically, the dog learns they need to do something polite, usually just sit to get the things they value. Treats, toys, petting, going out the door.
Ah, okay, so it's not a free-for-all.
Exactly. It adds predictability, gives the dog some control in a positive way, teaches impulse control, and builds good associations with being calm.
Sounds useful. And the research lists some key commands to teach too, right? Like focusing on the owner.
Yeah, essential skills. Things like teaching eye contact or hand target for focus, a solid sit and relax on cue, sending them to a place or mat, and, crucially, loose leash walking skills.
Those seem foundational.
They are. They give you tools to manage situations. And again, the source reminds us, use those safety tools like halters or muzzles during training if needed. Starting with one-on-one help from a good, force-free trainer is often the best way to build these basics.
All right, now for the heavy hitter. Systematic desensitization and counter conditioning. DSCC. Sounds technical. What's the core idea?
Okay, so DSCC, at its heart, is about changing the dog's underlying emotional reaction to their triggers. Slowly, carefully.
Changing how they feel about the scary thing.
Precisely. Desensitization means exposing them to the trigger, but at a super low level, like way across the street where they notice it but aren't freaking out. They're under threshold.
Okay, keeping it manageable.
Then counter-conditioning pairs that low-level trigger with something amazing, like super high-value treats, maybe chicken or cheese. The trigger starts to predict good stuff happening.
Ah, so the scary person across the street now means chicken is coming.
That's the goal. Create a new positive association. The source emphasizes baby steps, tiny increments. Maybe the person is slightly less far away next time or visible for a second longer, always staying below that reaction point.
Patience is required, I'm guessing.
Oh, massive patience. You have to watch the dog's body language like a hawk. Any sign of stress, lip licking, yawning, tense muscles means you've pushed too far too fast. You need to back off, increase the distance again.
It sounds like a careful dance.
It really is. The research notes it can take months of consistent work, and you might need different plans for different situations, like the dog reacting to people passing the house versus people on walks. Ongoing vigilance is key.
Okay. Now, the research also mentioned other things, surgical options like castration. What's the verdict there for this type of aggression?
Yeah, the source looked at that. For aggression towards unfamiliar dogs or people, the success rates reported were, well, pretty low. Less than 20% for unfamiliar dogs, less than 10% for territorial intruders.
Not exactly a magic bullet then.
No. It showed better results for aggression between male dogs living together, around 62%. But interestingly, one study found spayed female German Shepherds actually got more reactive afterwards. So castration isn't a guaranteed fix for stranger-directed issues based on this research.
Good to know. What about supplements? Things like L-theanine were mentioned.
The source positions those as potentially helpful for mild fear or anxiety, maybe as an add-on to training, but definitely not a replacement for it.
So supportive, maybe, but not the main event.
Exactly. They might influence calming neurotransmitters, and the source noted a lack of reported side effects for the ones mentioned, but keep expectations realistic, especially for serious aggression.
Right. And then medications. This sounds like a big one with lots of caveats in the research.
A very big one.
Yeah.
First, the source is crystal clear. No medications are specifically licensed for dog aggression. Any use is off-label.
Okay, that's important.
Absolutely. Which means owners need a deep conversation with a veterinary behaviorist, understand all the risks, potential side effects, give informed consent. And this is critical meds always need to be part of a full behavior mod plan. They are not a standalone safety net.
Never just pills alone.
Never. The source even warns they might not be suitable for all homes, like if there are young kids. And it mentions a strong placebo effect seen in some studies.
So results can be tricky to interpret.
Yeah. The effectiveness isn't always clear-cut. The research lists types like SSRIs, TCAs, others, and points out potential side effects for each. Things like sedation, stomach upset, irritability, even paradoxically, increased aggression sometimes.
Wow, okay.
Plus, risks of combining meds like serotonin syndrome. So it's a serious decision, only with expert guidance and always alongside training and management.
Understood. Very complex. Now, the research also talked about needing ongoing support. This isn't a quick fix, is it?
Definitely not. Managing aggression is often a long haul, sometimes lifelong. Having that continued support from a behavior professional, regular check-ins, helps keep things on track, adjust the plan, and just support the owner through it.
Makes sense. And looking ahead, prevention.
Yeah.
Which brings us right back to puppies, doesn't it?
It really does. That early socialization piece is huge. Getting puppies exposed positively to all sorts of sights, sounds, people, friendly dogs during that sensitive window like 7 to 12 or 16 weeks makes such a difference.
Good puppy classes seem key.
Yes. Well-run positive reinforcement classes. The source even mentioned a study finding no increased parvo risk for vaccinated pups in classes, which is good news for that old concern.
Okay. And finally, the potential outcomes. The research doesn't shy away from the tough realities.
No, it acknowledges the seriousness, potential for injury, the possibility of euthanasia or relinquishment if safety can't be managed. It reiterates there's no guaranteed cure.
But prognosis can be better sometimes.
Yes, the outlook tends to be more favorable if it's mostly fear-driven, lower intensity, and happens in predictable contexts. But ultimately, success really hangs on the owner's commitment to consistently following the management and training plan.
So wrapping this all up, tackling dog aggression towards strangers is, well, it's a journey. It means understanding the why, making safety the absolute #1 priority, and really committing to positive, reward-based training and management. No easy answers, no quick fixes, but being informed and proactive using the insights from research like this can genuinely improve things for everyone involved.
That sums it up perfectly. And maybe a final thought to leave people with. Just consider that incredible mix of factors shaping a dog's behavior, their genetics, their early life, everything they learn along the way. Thinking about that interplay helps us approach these challenges with more understanding, more compassion, and hopefully find more effective ways to help them navigate our human world. That power of early positive experiences and ongoing reinforcement really is profound.